Okay. I mean, you cannot record, is it on your side?
No, okay. Okay, but you record also, yes? We both record.
Yes.
Okay. Okay,
Can
sorry.
you see me? Can you see the slides?
Yeah.
Can you see the slides from there?
Yes, we can see.
Okay, so back to your question, I don't recommend patients to do chemotherapy or radiotherapy. But if they tell me that they are going for chemotherapy or radiotherapy, I can only tell them that my experience, but I cannot actually advise them not to go. Okay, it is not right for me based on the situation over here in Singapore. Yeah, so this is my present condition standing. Okay, so let's move on to look at the strategies of look at the protocol of Ontessu application on cancer treatment. So the protocols, I would say, let's divide the body into different sections. The first area I would suggest all of us actually perform is to work on the spinal area. To work on the spinal area in this case here, it means all the way from thoracic, from T1 all the way to lumbar 5. Okay, so basically, if you look at the spinal cord, let's leave the cervical part out first. From here, top of the shoulder area, all the way down, the 12 bones and the lumbar L5. Of course, you can go down to the sacral on the coccyx. Okay, so here the treatment is actually along the bladder meridian, both sides of the spine. Okay, so this section here. Again, if you look at the back of the of a person, so the bladder meridian, of course, both lines are the bladder meridian, but this is the inner line. The inner line is 2 fingers away from the spine. This line here, where we discussed earlier on, this is where all the back shoe points are located. For example, this is lung, this is heart, this is liver, this is spleen, this is gallbladder, and so on. All the organs points are lined up along here. Okay, along this line. And of course, one over the other side. So these are the 2 lines to apply. Okay, all the way from here, which is T1 all the way to L5 over here, or a little bit lower the sacral area. Okay, so generally, you just classify them into something like this: the upper warmer, the middle warmer, and the lower warmer. Okay, so the digestive part, the liver all the way to the stomach, the 4 important areas are in the middle warmer. Again, if we look behind, this is the stretch of the bladder meridian we should be looking at. Okay. So again, as you apply Ontessu on the region, look for the hot spots within the spinal region and treat them accordingly. Okay. So if they are stomach cancer, then of course you are looking into most of the hot spots should be around the middle back. Now this section from T1 all the way to L5, if you see it from the anatomical angle, this is the sympathetic nervous system. you can see that it is related to all the internal organs of our body, different parts to different sections of the organs. Okay, so it is very important. So it corresponds to the sympathetic nervous system of our autonomic nervous system. So all the internal organs are connected via the corresponding nerve, and their function can be activated by stimulating these nerves. Okay, so that's our first step. Work on the sympathetic part of the autonomic nervous system to activate all the internal organs. So this is another view now. So put heat into the bladder meridian here, which are shown over here in terms of the blue dots over here. And here the names are being classified, okay, so that you can understand. Okay, so this is T3, thorax number 3, T4, T5 here. Then you got 9, 10, 11, 12, the 4 organs there. Then the kidney is L2. Large intestine is L4, and therefore, and after that, the sacral area is where the small intestine and the bladder actually located. Now, so there is 1.5 chun on both sides of the spinal cord, which is 2 fingers. Look out for the sensitive hot spots and treat them intensely. If you use a pendulum to check the energy level of the hot spots, they would probably swing anti-clockwise. If you are in the northern hemisphere, of course. If you are located in the southern hemisphere, the direction will be reversed. Treat all the hot spots until the pendulum swings have been reversed. In other words, if you are in the northern hemisphere, you treat the hot spot until the pendulum swing clockwise. So that is the first protocol. And of course, we also, under the first protocol, we also input heat intensely into the GV14. This is on the governor vessel itself, on the spine itself. So we seldom treat the spine, we treat the bladder meridian. But in these 2 locations, you want to treat the spine. This is at C7, okay, and this is at T7. This is GV9. These are the 2 important yang qi funnel, just like this. You want to pour the qi inside your body. Use these 2 funnel. One is at GV14, the other one is at GV9. The best place to input yang energy into the body using your Ontsu device. And again, remember, all cancer patients are yang energy deficient. So these are the 2 places here. GV14, which is at the, when you bend down your neck, you can see a hump there, and you count down 1 knot all the way to the 7th knot, GV7. Okay, and the name of the Chinese name of this particular point is called Zhi Yang, mean reaching yang. You want to reach the yang. Okay, that's what it meant. So all cancer patients are yang qi deficient. Onetsuki is the best yang qi supplier. Okay, and in this case here, for all cancer patients, when you input the heat into here, into this section, you'll find that this area is typically very hot. Okay, so if the patient cannot stand the hotness, then one of the methods is to use the nano cover. Now, and if you don't know the nano cover, I shall tell you a little bit more about nano cover subsequently later on. Okay, so remember, these 2 are on the governor vessel, which is a spine, and they are the best yang qi funnel. The second part of the treatment is now work on the cervical spine region. Just now we focus on the thoracic and the lumbar area because that section is responsible for the sympathetic nervous system. Now we work on the section on top of it. This is the cervical section. Okay, from the C7, GV14, all the way up here, just underneath the scar. Notice that how the nerve is connected. Okay, the nerve come out from the scar, from the skull itself, and is actually connected to the various part here. And over here, there is a vagus nerve coming like this. Over here, there's a vagus nerve coming out like this. Okay, you can see it later on. So this is a cervical C1, C2, C3, C4, C5, all the way to C7. But for the nerve, there is a C8, but there's no vertebrae. The vertebrae is only up to C7. Okay, but remember, just so that's why people talk about C1 to C7. Okay, we have 24. C1 to 7 is 7. Thoracic, we got 12. And then the lumbar, we have another 5. L1 to L5. So add together, you have altogether 24 vertebrae, which are distinct. Okay, so this is a cervical spine region. And again, if you actually analyze this particular section anatomically, so this is the parasympathetic division of our autonomic nervous system. Okay, this is the parasympathetic. Okay, so this section here is very important. You work on this section here, it relaxes the patient and it helps the person to reduce the stress. The parasympathetic nervous system, of course, also include the near the tailbone area. Okay, typically the coccyx area here. Okay, so they affect the bladder, the genital in terms of the parasympathetic division. Okay, so you can see from here, if we want to actually balance this patient, balance the patient's autonomic nervous system. First, we started with sympathetic nervous system. Okay, from this particular section here, all the way down to here, that will stimulate the sympathetic nervous system. Next, we go and stimulate the parasympathetic nervous system, which is here, as well as the tail here. That will actually excite the parasympathetic. So if you combine the sympathetic and the parasympathetic together, you balance out the patient. You balance out the patient. Many patients, of course, are stimulated easily through the sympathetic, and they don't have opportunity to stimulate the parasympathetic. And I mentioned earlier on that just behind the skull, it comes up with a nerve. And this nerve here is an important nerve. It is the longest nerve in the body. It is called the vagus nerve. This vagus nerve, it is connected to all our internal organs. Okay, so activating the nerve on the side of the neck over here is so important that if we want to provide health to any of our internal organs. So on a daily basis, we must learn to stimulate this nerve here, which is called vagus nerve stimulation. Okay, of course, it is stimulating this section means you are stimulating the parasympathetic nervous system. Okay, so activation of this section stimulates the vagus nerve and it connects to all internal organs on our body, to the brain. The vagus nerve stimulation promotes relaxation and reduces inflammation. and it has a positive effect on the patient's mental health, their emotion, helping them to feel calm and compassionate as well. So how do we apply heat using Onetsu on this region here? I would say divide them systematically. Apply on the left side of the neck, okay, from this section all the way down, from here, this section down. Likewise, on the right side of the neck, all this way down. At the same time, don't forget the behind, the back of the neck. Okay, so there are three. In other words, you want to stimulate the parasympathetic nervous system. Remember the left, the right, and the back. Three important sections. Okay, and if we examine the acupoint from the acupoint angle, the back of the neck is also related to very important acupuncture points. In this particular case here, okay, this is often, you know, you go for a body massage. The masseur will always try to massage here. This is the GB20 point. And GB20, basically it dispels interior and exterior wind. It makes your head to be clear. It benefits the eyes. It promotes the blood circulation. It is good for the nose if you have sinus. It's good for the ears if you cannot hear clearly. Okay. It also subdues the liver yang, activate the meridian, and also relieve pain as well. So this is this pair of acupoints here. Okay. Part of the gallbladder meridian. And the other pair of the points are what we call the BL10. Okay, the bladder meridian number 10 here. It also expels winds, activates the meridian. Okay, benefits the head as well. Also reduce pain. And of course, opens the sense orifices. So that is the purpose of the second part. It balances the autonomic nervous system. Okay, when we work on the cervical spinal area, we are stimulating the parasympathetic nervous system. Also activates all the internal organs, promote qi and blood circulation to the head. Okay, later on you shall see how I treated tumor in the brain. Okay, so this section is very important, and therefore increase the immunity and reduces stress and inflammation and promote relaxation. Okay, so by doing so we have already gone through the stimulating the sympathetic and also stimulating the parasympathetic. The next, we want to work on the tumor sites now. So far, we only work based on the traditional medicine principles, the meridian points. Now we want to work on the specific tumor sites using hyperthemia principles now. An earlier research by the Japanese showed that cancer cells, as I mentioned, die rapidly when it is heated to 39.6 degrees and above. So now we can locate the position of the tumor cells using a tool, a pendulum. Of course, apart from pendulum, can you use another device? Yes, there are devices. Okay, I mean, Dr. Jerry Tennant from USA invented a device known as biomodulator, a tiny little device of this size. It measures the voltage on the skin. If you just turn it on to the certain access mode and then position it on the tumor site, you will find that the voltage on this particular location typically is much lower compared to the other part of the body. That actually tell you this is a problem area with very, very low voltage. Okay, in his book, okay, low voltage is a problem for many chronic illnesses. Cancer is one of such. So just use methods to raise the voltage. Okay, and if the voltage is sufficiently high, the tumor cells will disappear. Okay, that is actually from his principle. So you can locate the position of the tumor cell. For me, I use a pendulum, very easy to use. And you want to treat the whole region. Treat the whole region. And here, you really want to make use of the hypothermic principles here. According to hypothermia, cancer cells die rapidly on 39.6 degrees and above. So I want to trigger it until a temperature which can be tolerated by the patient. And I find that typically, if the skin temperature reaches 40 to 41, and in some cases, rare cases, some patients can be actually tolerate up to 42 degrees Celsius. Then I think in this case here, there will be a good chance that internal temperature might be very close to this. Might not reach 39.6, but close to it. But close to it meaning that we are using the principle of changing the environment inside there. In other words, even though it is 39 degrees Celsius, but this temperature of 39 degrees Celsius, which encourage the flow of blood to that area, is not conducive for the growth of the cancer tumor, of the cancer cell. And therefore, prolonged activation of this region with high density of blood flow to the area will discourage the growth of the tumor. Subsequently, the tumor cell, the cancer cell, will commit an apoptosis and leave the area. So that is the principle behind. Okay, so you can always check the temperature. If you are not familiar, check the temperature with a contactless thermometer. Again, treat the whole region, not only the point, treat the whole region until the pendulum swing reverses direction. Repeat when pendulum swing return to the unhealthy condition. What does it mean? What I found is that for patients who are in severe condition, yes, you spend 10 minutes treating the area, the pendulum has already swung clockwise. As you move to treat another location, the pendulum, when you come back and check the condition of this place, the pendulum swing has already come back to the abnormal condition again. So that is the situation with many severe or late stage cancer patients. So we have to influence that section of the body slowly. So that's why the frequency of treating the tumor site frequently is very important. Okay, you try to improve the conditions at the tumor site there. If you have problem, if the patient has problem, what you can do is to put on a nano cover and position the Onetsu key with the nano cover at the most difficult site for extended hours. You know the nano cover, you have not seen it before. This is how the nano cover works. Okay, the nano cover with a casing like this and with this metallic substance, a plate over here, which is made of a special material with nanotechnology. You put on the cover here and then insert your onetsuke into it. Okay, incidentally, this nano cover here can work with all types of Mitsui onetsuke, MI02, 03, or 04. All can fit it exactly the same. So once you put it inside there, you can now put the whole device on the bare skin without using any clothes. Even if you set the temperature of the device, to, let's say, level 5, that is 70 degrees Celsius. There is no problem with the nano cover. You can actually leave it on the skin for extended hours, maybe 20 minutes, directly on the tumor site. So in other words, this method now allows a cancer patient to provide deep healing onto the stubborn tumor site for extended period of time. Although the patient might not feel the heat so intensely, according to research, more heat actually penetrate into the region. So in fact, the nano cover is invented for this type of patient who need deep treatment using the onetsuke device. Okay, I encourage you, if you have not actually seen nano cover is self-functioning, try to actually see Miss Zoha and then see how it can be used and experience it yourself. So I mentioned that you want to, using the hyperthemia principle, you want to treat the whole region. So what is meant by whole region? In the book written by Tomiko Mitsui and actually translated by Kazuhira, it actually describes pictures like this. For example, this is a picture taken from the book for the treatment of cancer patient, liver cancer patient. So therefore, when we say treating the whole region, we are treating the, in this case here, the front, the back, and the nearby area. So the liver might be just over here. Okay, but the nearby includes the abdomen. Okay, I mean the stomach area as well. Okay, the front section, but the black section. The darker color means more intense. Okay, the light gray color means less intense. Okay, so this is what is meant by front whole region. Okay, look at another example as illustration. So treatment for breast cancer, you can see from there. Treating the whole region means the front, in this case here, up and down the shoulder of the two breasts. The back will be the upper back, including the up to the lower back and the middle back, okay, plus the underarm section where there is plenty of lymph nodes over here. That's what it meant by treating the whole region for breast cancer. Okay, so that was actually working on the specific tumor site using hyperthemia. Hyperthemia means must take control of the temperature, 40-41 degrees ideal. You can also actually wrap the area using the Crayon mat like this. For example, if the problem is a stomach here, stomach cancer, okay, you can actually wrap it out using the Crayon mat and set the mat to the maximum temperature possible. In this case, the temperature will be 54 degrees Celsius for the mat itself. The mat also can allow you to actually sleep on it for extended hours during the night to keep the body warm. But here we are talking about using the same mat now as a wrapper to wrap the body for a 40 to 90-minute session. Okay, do remember to replenish water during the treatment process here. Okay, so the count mat, this is a count mat in case some of you, because previously we did not have the count mat for 220 volt. We only had 100 volt version for the Japanese market. But recently, about a month back, we released the newest version of count mat, which is 220 volt here. Okay, so you can use it for overnight sleeping. You also can actually, many patients find it very useful because it can be wrapped it up and then put into the bag provided and then carry around. Wherever you go, they always carry this. Now, the fourth part of the cancer treatment protocol is to work on the digestive and the immunity system for all types of cancer. I mentioned in the TCM section, we said the first step based on TCM principle is to stop the yang qi from depleting. Second thing is to build up the qi, the yang qi. And in this case here, how to build it up? Of course, apart from using an Ontessu device or moxibustion, you can make use, you can actually improve the functions of the spleen and the stomach. And this is talking about the digestive system. It also includes the immunity system. Okay, so for cancer patient to get healed, the stomach qi cannot continue to deplete. And the stomach qi in this case here can be raised by applying Ontessu to the acupoints here. Okay, we have discussed those. Okay, so this is ST36, just for revision. This is SP6. This is CV number 12, conception. This is bladder 20 and bladder 21. Okay, this is spleen and this is stomach. Okay, where this is just below T12, this is T11. Okay, so if you work based on this, you are actually improving the spleen stomach functions. Okay, which means the digestive and absorption function. Okay, so in summary, working on the digestive immunity system means in this case also includes immunity of the patient. Okay, in this case here is really on the belly button and its surrounding area, which is the small intestine. Okay, and in the small intestines, it houses 60 to 70% of our immune system. It also includes a longevity acupoint of CV4, CV8, and of course CV6 as well. And just a revision again on the CV points. Belly button is CV8. CV4 is actually 4 fingers down. This is belly button. 4 fingers down. This is CV4. CV6, which is another important point I did not list here, is in the middle here. 2 fingers below the belly button. These are all important points in terms of raising immunity. Okay, so this is how you work. In other words, just apply the heat over here until this whole section here is pinkish in color. Okay. So Ontessu intensely into this area produces 2 effects: improvement in immunity and of course improvement in terms of the nutrient absorption ability. Now this diagram here, just to help you understand, this was what I talk about when I talk about congenital constitution. This is the acquired constitution. You want to gain health. If you have a weak congenital condition, the only way for you to build this up is to improve your spleen stomach function. Every day you have one excess, put a little bit inside here. Excess again, cultivate excess from here. Every day, put this into the reserve. This is something like bank reserve. Don't touch it. Okay? Every day, try to improve the spleen stomach function, and then any excess will be put inside the stomach area. And this is how we slowly increase the original congenital constitution through the activation of the acquired constitution. Yeah, so this is what it is. Congenital constitution and acquired constitution. And this is what TCM practitioner has been emphasizing years. Okay, I have finished my main PowerPoint. I want to stop at this juncture to provide you with some case studies and then to take questions from the participants. Shall we look at the cases first, or you want to ask questions first?
Case first.
Okay, case first. Okay. So I have provided all the cases are my experience. I think there are eight cases here. Some are successful, some are not successful, some are not very successful. But I want to share with you all these cases so that I think whether it's successful or not successful, we can learn something from there. And we can talk about how to improve should you encounter a similar case like this again in the future. And this is the purpose of this section here, the case study. The first case is a young girl, 19 years old, high school student. So you must be wondering, what has cancer to do, or what has tumor to do with this young high school girl? According to the parents, this girl often fainted in the morning, especially on days where she woke up late. Okay, so that gives you some hints on this patient, on this girl. Fainted in the morning, not in the evening. Especially on days when she wake up late and want to go to school. If you are this girl, what would you feel?
She don't want to learn.
Sorry?
She don't want to learn.
She doesn't want to learn. Okay, that is one. But she did wake up, and she rushed to the toilet but fainted inside there. So are you saying that she faked it? Maybe, but actually especially when she woke up late. No mind, let me just go further. Also complain about headache frequently. Okay, so that was from the parents. And because it happens so many times, so the parents actually eventually went to the hospital and seek help from a neurology department. And the brain scan actually show the presence of a 3 centimeter tumor on the left side of the brain. Okay. 3 centimeter tumor on the left side. And again, you know, the doctor recommended surgery to remove the tumor. Family not keen to let the girl undergo surgery because the doctor only can tell the family 50% failure, 50% success if she undergoes this, but this is the only option given to her. This is what the parents has told me. And a friend of theirs actually recommended her to me. Of course, when I first saw her situation, this was many years back before I practiced, before I actually started to use pendulum professionally. Early years of using the pendulum. But still, I could still locate the location of the pendulum. Okay, that particular location, the tumor, I mean, the pendulum was actually swinging anti-clockwise. I actually taught the mother to apply Ontessu. Of course, they did not buy the device on the first encounter. When I explained, both the parents came with the daughter. I checked, and of course, I look at her situation. I explained to them how to use the treatment. Okay, I said this is a side effect free method of trying to help the daughter, not to cure it permanently maybe, but to help her in terms of overcoming the tumor, overcoming the effects on the girl. So I show the mother how to apply on the daughter. After they went back home, they discussed among themselves, and then 1 week later, they came to purchase the device. Of course, I used the occasion to demo directly on the girl, and subsequently, they brought back the device. Okay, again, the concentration was on this indicated section. I told them, okay, these are the regions you need to work on. But in addition, where the tumor was actually situated on the left side of the head, slightly towards the back, I asked the mother, okay, to leave out the hair and trim off the hair, the inner layer, so that you still have the outer hair to cover the head, but the inner side is like, when you leave out, that area is empty actually. So you can actually put the heat into that particular section there. Okay, shave the hair there and apply heat intensely in that particular area. That was the occasion I taught the mother to do. Okay, they brought back, because they stay away from my area about 100 kilometers. And the good girl, of course, attending high school. 3 months after the mother started the Ontessu therapy for her daughter, the girl had not had any fainting incident. In other words, the girl does not faint anymore. So first of all, I think we need to understand why does fainting take place? How come someone fainted? the fainting, of course, could be momentarily. In other words, somebody get a shock and then fainted momentarily for a few seconds and then regain her consciousness again. Fainting. What is the mechanism in the brain when someone experiences fainting? According to Chinese medicine, fainting in this case here is the temporary obstruction of the blood flow to the brain. It could be a couple of seconds, fainted, and then suddenly, or half a minute, and then woke up again. Somehow. So the girl on the days where she wake up, she was very anxious because she would be late for school already. And in the morning, because upon waking up in the morning, the body's temperature is the lowest and blood circulation is the worst because the physical body has not been active yet. So that was the reason why the girl fainted often. On the day where she woke up late, she became anxious. She was worried that she'll be late for school. And once that strike, the blood circulation to the head area get worse, and she fainted. Now, through the use of the Onetsu therapy method, the blood circulation to the head has considerably improved. With that, the number of fainting incidences in this case here had actually gone to zero in the 3 months after the mother started this. 1.5 years later, actually starting this therapy, the girl had graduated from high school and started to work already. 6 monthly follow-up at the hospital showed that the tumor had not grown in the last 18 months. Okay, so every half a year, the girl still go back to the hospital for her check. But so far, after 18 months, the tumor had not grown. And the girl has actually graduated. I actually have invited the girl to come back for my repeat assessment. But the parents said, and they are happy also, that the girl is satisfied with her present condition. Her benign tumor does not affect her. And she performed the therapy herself regularly. So this is a case of using the Onetsu therapy to deal with brain tumor, a benign brain tumor. But in this case, does not affect the life, does not bother her anymore. So therefore, I think one of the reflection we can get from here is that sometimes coexisting with the tumor could be an approach that some cancer patient also can choose. In this case, the girl is actually, of course, her tumor is benign, not malignant. So, but then hospital recommended her to do surgery to remove it. If she actually followed the doctor's advice, there is a likelihood, 50%, that she may have very bad outcome, may affect her brain permanently in a negative sense. But she chose with this method. I mean, so how do you see this case? If you are a parent of this girl, what do you do? Are you satisfied with this, but continue to encourage the girl to do the therapy? And what else can we do to help this girl? I just want to open to the floor for discussion. Anyone?
Anyone would like to answer? They're tired.
Okay, they're tired. Okay. Never mind. I will go through the cases quickly. The second case, another young girl, 21 years old. Again, from the mother's feedback, a slow learner since young. Currently, when I saw her, she was not studying. She also was not working. Detected a tumor in the brain several years ago and had been monitoring it via a private hospital in Malaysia. This is another case of a young girl with a tumor in the brain. The mother came to know about Ontessu through her brothers. Okay, I did not know the case, but the brother actually came to us by the second device. The brother had learned Ontessu before in one of my courses and asked him to buy the device for her daughter's use. And the mother passed the Ontessu device to her daughter and told her to use it herself, where to use it, as she was very busy in her own work. However, a repeat checkup at the hospital 1 year later showed that the tumor had grown significantly in size. When the mother questioned the daughter told her that she used it sparingly, sometimes use it, sometimes not using it, and only use it for 15 to 20 minutes. Of course, that kind of frequency, that kind of usage is not going to actually be effective for her tumor. So the mother realized that she needed to do something, or else her daughter's condition might get worse. In fact, the girl's left eyesight was also getting worse. Some days she could not see at all. Okay, again, the hospitals wanted the girl to undergo surgery because according to the hospital, the tumor was pressing on the optic nerve. That's why the girl cannot see. But why the girl, if the tumor was pressing on the optic nerve, but how come the girls sometimes can see, sometimes cannot see? This was not explained. The doctor did not explain. The mother realized that this is really important in order to save her daughter. The mother resigned from her work and started her own therapy on her daughter. She took her to the hot spring nearby once or twice a week. Now, and this is what the mother told me, very interesting. After a hot spring soak, the daughter told her that her eyesight had improved and it lasted for several hours. Okay, hot spring. If you go to Japan, you like onsen, you go for the hot spring. Okay, so in this case here, the girl actually soaked herself in a hot spring at 40 degrees Celsius or so, and then somehow her eyesight become better and he can see things for several hours. So then the mother, she told me about this. I told her to come down to see me in my center. So one day, she decided to drive for 3 hours to my center to see me. She stayed overnight so that she can undergo some other therapies as well. So I checked on her meridians using the pendulum. I found that the heart meridian and the pericardium meridian, the energy flow was bad. There were blockages in these two meridians. At that juncture, I performed an experiment. Okay, an experiment to see, to verify my hypothesis, and that also set out my protocol for treatment. The girl actually has devised a method to check her eyesight. Remember, I said her left eye is not good. Sometimes she cannot see with her left eye. So it's actually based on the right eyes. Okay, so she has devised a method, in other words, cover her right eyes. There is a good eye. And then try to see something about 1 meter or 2 away from her. And then she will tell you, okay, she will tell the mother how much she can see. Okay, and from there, she can actually estimate 10%, 20%, 50%, 100%. That is a scale she designed herself. Okay, so I asked the girl now, at that moment when I started this experiment with her, I said, cover your right eye now and perform, before I perform the Onetsu on you. And she covered her right eye. She told me 10%. Very little light I can see from there. Okay, so that was 10% as a starting point. I asked the girl to lie down with her face downwards. I checked her spinal back with a pendulum, her upper back, especially T4, T5, T3, T4 region. The anti-clockwise swing was very, very strong. And again, these are the back shoe point for the heart and the pericardium meridian. Earlier on, the checking on the meridians was actually based on the, remember the fingers as well and the toes. Now I actually verified the presence of this blockage on the heart meridian and the pericardium through the back shoe point of these two meridians. I worked then intensely on the upper back for 10 minutes. And then another 10 minutes on the neck, on both sides of the neck, and then on the back of the neck. So in total, I spent 20 minutes on the upper section of the girl, of the back, and then the neck area. And I asked the girl to sit up and check her eyesight. This time, her problem eye covered the right eye, and her left eye could see 70% based on her own judgment. So from here, what can you tell? I want to ask you now, participants, what is the problem? The doctor say the tumor was pressing on the optic nerve. That's why the girl could not see. But this experiment show us, does it show the same thing? If not, then what? Anyone? Comment?
Someone say blood flow.
What?
Blood flow.
Yes, blood circulation, right?
Yeah.
The blood circulation could not reach the part of the eye. Blood circulation. How did I improve the blood circulation? I work on the upper back. The upper back was actually had a anti-clockwise swing for the heart as well as the pericardium meridian there. The heart was weak. The pericardium was weak. That is the source of the problem. So I took 10 minutes to therapy that section, okay, and improve also the vagus nerve as well as the parasympathetic nervous system. With those 20 minutes treatment, the blood was flowing well into the head as well in this particular case here, into the eyes as well. With that, the girl could now increase her sight by almost 60% based on her estimate. So this is, okay, this is actually the problem. The problem is not the optic nerve as described by the doctor. It is due to poor blood circulation. So therefore, I advise the mother on the following: to therapy the upper back, to therapy the neck area, and of course, I identified the tumor site as well in the brain, and to put heat into that particular part of the brain as well, of the head as well. I also advise the patient to take 2 supplements. I asked her to take ubiquinol CoQ10 200 mg on the daily basis to enhance heart function. And also I asked her to take this vinpocetine, another supplement, 10 mg 2 times a day to enhance the blood flow to the head region. That was what I advised the mother. The mother decided also to purchase a Crayon mat for her daughter as her condition was worse in the morning. Yeah, again, nighttime is the time where the body temperature will cool down. And when the body temperature cool down, blood circulation will be stagnated, will be worse. That's why in many of the cases where the blood circulation is not good, morning time is the most problematic time, including dementia patients, including Parkinson patients. Okay, so what is the outcome here? Currently, the mother has reported that there is a significant improvement in her eyesight throughout the day. Upon waking up in the morning, the girl's eyesight no longer see nothing. The girl can see 50-60% in her troubled eye. And upon applying Ontessu to her body herself, some days, and by her mother on some other days, she could improve the percentage. 1 year has passed actually, and 2 rounds of 6 monthly checkup by the neurologist show that the tumor is stable and not growing. So with the last follow-up call a couple of months back, this case was a new case. This was about last April when the border was reopened after the COVID-19 restriction was lifted. She came to see me. So the family currently is happy with the outcome, and the girl continued to receive the therapy from her mother as well as on her own. And she continued to take the supplements, and energy level has also improved. Yeah, so this is again a case where Ontessu therapy help, in this case, again, a benign brain tumor patient manage a condition, okay, without undergoing the risky brain operation. I mean, some of you might ask, will the tumor disappear one day? I don't know. I think I am not sure as well. But has the therapy been useful to the patient? Certainly. I think good for the patient and less worries for the parents too. So this is the second case also. I happen to treat, brain tumor. Both cases are young girls. I don't know why. The third case I want to share with you is a lung cancer patient. The patient is a 50+ man. When I met her in 2012, I was running a course in the capital of Malaysia, Kuala Lumpur, for the first time. So he came with his wife to enroll for the 3-day Mitsui Onetsu therapies course. She was very, very skinny. I remember very, very clearly. He had lung cancer. I could not remember was stage 2 or stage 3 for about 2 years. Initially, he went for chemotherapy, but a lot of complication. He stopped that, and he was looking for natural healing methods. That's why, through a friend, he found us, and my colleague invited him. At that time, I did not station in Kuala Lumpur. So encourage them to come and learn to heal himself. So he resigned from his work and enrolled in he also resigned from his busy working in a multinational company and enrolled in a healthy diet program to improve his health. So he was very serious. Okay, not only come for the 3-day Onetsu course, he also enrolled himself in a healthy diet program. So as he was in KL and in Singapore, I only saw him 2 times, but we spent a lot of time teaching him. Okay, remember, teaching him and his wife how to do the self-healing for the 2 occasions. Of course, the 2 occasions, I treated him. Sometime later, I also, when they wanted to go to Japan for their holidays, I recommended them to visit the Mitsui Onetsu clinic in Tokyo. And I have managed to arrange with the Mitsui Onetsu clinic therapies, an intensive program for 2 weeks when he was there. Intensive meaning that for 5 days a week, morning 1 therapy session, afternoon 1 more therapy session. That was for him. Purposely arranged for him for 2 weeks. But soon after that, we lost contact. Again, as I mentioned, I stay in Singapore and he was in KL and so busy. I lost contact with him until 2018 when he called me again. I was surprised when he called me. And according to him, this is a story he told me. He managed to heal his lung very well. Over the first 2 years of applying Onetsu, and his diet, the healthy diet protocol, his lung spots, you know, the spot, the scar, okay, the spots on the lung disappear one by one. When the lung spot were reduced to only one very stubborn one left in his lung, he came across, okay, a therapy known as cyber knife. And he went for it because it took so long to heal this one. And he could not wait. He went for the cyber knife. And it managed to remove that particular spot as well. Okay, I don't know much detail about cyber knife, but that was what he told me. After he became cancer-free for 6 months, in other words, he went back to the hospital to check his lung. He was cleared, run his cancer markers, was normal, follow up at the hospital, and then he continued, and he was found to be cancer-free. Once he was cancer-free, he was so happy. He kept his equipment in the cupboard and left for a holiday, for a world tour. I didn't know how long. Since then, he has been traveling, according to him, traveling to many places, enjoying life. When he called me in 2018, that was a time he was not feeling well with his bowel. He noticed that his bowel, his colon, wasn't well. So he went to see a specialist, and he was diagnosed with colon cancer. Then he realized years ago, he made use of the Ontessu device to heal himself. But when he took out the device, he couldn't remember how to use it anymore. That's why he called. I met up with him maybe 2 to 3 months later when I went to KL. Of course, before that, I already taught him through the phone call how to use the device. But when I went to KL subsequently, I met up with him and, of course, taught him, demo to him, and performed the therapy on him as well. But again, that was 2019. And when COVID started, traveling banned. And again, I lost contact with him. I'm not sure about his present condition. I don't know whether he had been so lucky, able to heal his colon cancer as well. Now, I share this case is really to share this important point. I always advise all cancer patients to continue using the device even though they may have been healed. Continue to input young energy into the body will increase the likelihood to remain in good, healthy condition for a longer period of time. This is what TCM call treating future diseases. You don't want a recurrence. And in this case, from lung spread to the colon, it is a natural spread. Right? Earlier on, I mentioned to you, there are a few pairs of organs in the body. Like spleen is always paired with stomach. Lungs is always paired with large intestine. So for lung cancer patient, always look out for your stomach as well. Okay, so this is a third cancer case I want to share with you. Let me share with you another case, a stomach cancer. This is a recent case, This recent case is barely 6 months, not yet 6 months. The patient was a 60-year-old lady who suffered from stomach cancer. She was due for surgery to remove part of the stomach. But after the operation, the surgeon did not want to proceed anymore because he found that the cancer has spread not only inside the stomach, but also outside already. So he said removing part of the stomach does not save her. So subsequently, they gave out the the surgery. The patient could not eat any food, there's a misspelling here, sorry about that. Only rely on liquid food. Again, found us through a close relative. Without hesitation, he bought Oonatsu with a car-on mat in March this year. The husband actually worked on him. I also found that the heart of this stomach cancer patient was very weak. The meridian, apart from the stomach meridian, this heart meridian was also blocked. So I taught the husband to provide the treatment, okay, on her back 3 times daily. But the patient, a little bit stubborn, could only manage about 2 times, okay, because of the intense pain. They did not get the nano cover. Despite all that, the symptoms of the stomach seem to have gone down a little bit after 2 weeks of treatment. In my center, I also have a hyperthermia system, okay, where it's like a dome, where the patient go into the dome for the treatment for at least half an hour to an hour, depending on the tolerance level. I advise the patient to come for hyperthermia treatment, but she could only come 1 to 2 times on a weekly basis. But patient continue to survive only on milk without any solid food. This lady was not a dairy person. In other words, she did not drink milk until at this age where she could not take any other food. She told me she did not like the taste, the smell of the milk. So what does she do? She gobble the milk. She, in other words, go into the mouth quickly, get the milk into the stomach. Did not munch. I advise her, okay, although it is a liquid food, you want to grind. When you drink it, the milk is in the mouth. You want to actually exercise your mouth, okay? In other words, sway around the milk in the mouth, so that the salivary gland can function and start producing some enzymes to help digesting the milk. But she refused because she did not like the taste, the smell of the milk. Okay, that was the problem with her. About 2 months from starting the Oonatsu therapy, the daughters decided to take the mother to a cool hill resort for a short getaway. However, the patients didn't enjoy the holidays because she felt sick after traveling for 3 hours on the road. In fact, she vomited badly after that. After her return from the trip, her conditions continued to worsen and she vomited blood. The family sent her to the hospital emergency and found the stomach bleeding again. And of course, the doctor convinced the patient and her family to let her undergo chemotherapy. After receiving the first chemo session, she passed on. That's a very sad case I've treated so far. But here, the purpose for me to share this unsuccessful story is a point earlier on I raised when I said, if the stomach chi continue to leak and depleting, then the hope for surviving is approaching 0 and days of survival are numbered. Okay, so here it is the stomach chi. Okay, the young, we could not sustain life if the stomach actually is not functioning. So that is the reason why even for patients who undergo stomach surgery to remove the stomach totally, the patient, although may survive for 6 months to a year, he or she will eventually die. Okay, stomach chi is very, very important. That is the most important if ever the cancer patient want to heal his or her body. Okay, stomach cancer patient, this is my sharing. Okay, so many stomach cancer patients die within a short period of time unless the stomach is repaired quickly. So if you ever find a stomach cancer patient, the first thing is to repair the stomach first. Try all methods. Convince the patient. Okay, convince the patient to heal the stomach. Okay, and all methods. I advise the patient also to take Chinese concoction, but she complained about the taste of the concoction and that she did not use it. Now, the next patient is a prostate cancer patient, which is also very common among men. I want to share with you, this patient was a 75, this was many years back, 75 years old man with a very high PSA value. When I know him, he was already due for surgery. I know the daughter. When the daughter told me that the father was going for prostate surgery, I recommended the Ontessu device to her. Being a good friend, she bought, although she was not in Malaysia. This again patient is in Malaysia. She bought it and asked me to show her father how to use it. I went down to the house to show the father how to use the device 2 times daily. 3 months later, his follow-up checkup at the hospital showed that his PSA reading has plunged from a very high to a normal range. And I was told that the ultrasound scan also showed normal prostate. Subsequently, the hospital surgery plan for the prostate was also dropped. But he continued because he continued to receive the to go back to the hospital for normal checking. And he continued to use the device diligently over his body. And in fact, on several occasions where he came to my center to see me, he told me that his health, overall health, has improved significantly. Okay, so that was the diagnosis after 2 years of actually working on his prostate. And in fact, our patient actually remained healthy after 5 years of starting Onetsu, but the frequency of using it seemed to have reduced, according to the daughter. In year 6, I did not mention that the patient actually has the habit of smoking. Did I mention it somewhere earlier on?
No.
Yes, okay. Yeah, he went back to his smoking. And in year 6, the patient experienced fatigue. Okay, also asthmatic at times. The checkup at the hospital showed that he had COPD. When his condition got worse, he gave up his smoking. But then, this was early part of 2020, the COVID-19 restriction actually started. And I was separated. I didn't know about the patient in Malaysia because I could not travel during that period. One fine day, his daughter dropped him at the hospital, and he walked into the hospital by himself to receive some form of injection or vaccination. They did not tell me exactly what was that, and the daughter was also not sure. 30 minutes later, the daughter received a phone call from the hospital informing her that the father had just passed on. That was again during the period of COVID-19 restriction. What exactly happened, I don't know. But here, I just want to share the cancer patient in this case. He was healing the prostate cancer quite well. And then his complications started because of his return to his smoking. And subsequently, he had COPD. Okay, and I did not see him for almost 3 years during the restriction period. But then, when the border reopened, he has already went to heaven. Yeah, so this is a case. Okay, and you can judge for yourself how the prostate helped him at least in the first 5 years. But of course, by mainstream medicine practice, if you are free from cancer for 5 years, you are healed. Okay, that is what they use. Case number 6 is a breast cancer patient. Patient was a 55-year-old lady who underwent surgery to remove one breast, and subsequently, he also performed chemotherapy. Okay, okay. In other words, when she saw me, she already underwent surgery followed by chemotherapy earlier, 1 year before. 1 year after this treatment, her second breast also affected. When I saw her, the ulcer on her breast was bad. Of course, she showed me through photograph. She take out the picture, take the picture herself, and then show me the picture. Okay, she is a Muslim. Okay, so I could only that's how I actually communicate with her, treat her. She decided to seek alternative treatment because her oncologist suggested her to undergo chemotherapy, as her first experience was very painful. So she didn't want to go. She was looking for something. As I mentioned, her ulcers were very bad. She needed to go to hospital to have the wound dressing changed regularly. Almost every 2 days she need to go. Okay, and it got piles inside there from there. Okay, subsequently she did it herself at home, where she lived alone most of the time, as her husband was also working outstation. Meaning that she did not eat well as well, because nobody cooked for her. That was one of the problems as well. Now, because her breast, both sides, were covered with ulcers, she could not perform the Ontessu therapy there. We could only perform it in the abdomen and in the back region. Moreover, there wasn't anyone who could help her at home, especially when it comes to the back. So she came to see me, okay, very diligently, once a week when I was at my clinic in Malaysia. And of course, I performed Ontessu on her spinal area. Many hot spots, pendulums was turning anti-clockwise, of course. Her energy level increased, although the ulcer on her breast area did not heal as expected. That was the first incidence, my first experience of me trying to heal the ulcer on the breast of a cancer patient. My previous breast cancer patient did not have ulcers. This one, very, very bad ulcers. I did some research and I helped her to buy Manuka honey gel for her to apply on her wound area, because Manuka honey gel supposed to heal the wound, but that did not help her very much. Despite all those, she continued her healing. In other words, in terms of energy, in terms of pain, she seemed to have actually improved, but the ulcers could not seem to reduce. In fact, some new one and smaller ones start to come out from other sections of the breast area, including the site where surgery was performed. Despite all that, she felt she was sufficiently healthy, and the family decided to have a vacation in some cold countries for 2 weeks. Upon her return, her health deteriorated and she became very weak. She could not drive to see me at my center anymore. And again, COVID-19 restrictions started and I was prevented from going to my center and visiting her, perhaps. Nevertheless, the patient went back to see the oncologist and she convinced her to undergo chemo. Sadly, that speeded up her passing on. After her third chemo session, she passed on. Okay, so that is the another case. I mean, the survival time of this particular patient perhaps is actually from the time she saw me till she passed on is about 3 years. I did not know how to heal the ulcer. Any one of you have the experience of healing breast ulcers? Anyone?
היא עדיין חיה, אני לא יודעת איך, יש לי מטופלת בדיוק כזאת והיא עדיין בחיים, אז לא מצליחה.
I just saw a case, Dr. Kazuko case that you can find in the internet. For now, the person that came with this kind of ulcer, they just didn't work, like they didn't come often, they didn't buy Ontessu, like unfortunately people that arrive to this stage many times just not not strong enough to heal themselves, not strong enough mentally. Like they are coming like too late for them, not too late in a term of the potential of healing, like they are too weak to work for their health.
Yes, I think so. I mean, I feel that because she doesn't have any family support, although she has a daughter who had married and stay in another city, and her husband who is working is also away from home, 200 kilometers away. I mean, so she was by herself, and I think family support, I think mental health, I suppose, was not very good.
But
Yeah, so
if I were you,
yes.
I was working on the ulcer on the breast with a fabric, because like what I saw whenever I have a really like severe infection, it's really important to work on it. So although it's like quite disgusting and yes, but in case of ulcers, that it's like life saving. For me, I think that I was working on it.
So you would actually use a nano cover and put on the ulcers directly, what you're saying, right?
Okay, man.
Yeah, okay. Quickly, another case, prostate cancer as well. Patient actually...
Man, what's
Sorry?
the clock? What's the watch?
No, this is another aspect of the treatment I want to share. I think it's important. May or may not be successful, but I want to share the case so that you know. A patient, 75-year diabetic, who actually undergo hormone therapy. Very common for prostate cancer because the doctor tell them that your testosterone is too high, so you use a hormone suppression method to suppress the male hormone. Okay, and then he started hormone therapy already 18 months earlier. And of course, he called me for help as I know him. And of course, since then, I have been actually giving him 2 hours of Ontessu therapy on a weekly basis for more than 2 years now. Okay. And in the first 3 months of my therapy session with him, I noticed a significant deterioration in terms of his cognitive function. In other words, his recall function of his brain as well as his physical function also started to deteriorate. That was during the COVID restriction time, and I actually organized a Zoom session and to propose to explain to the family how the side effects of the medications were, and I explained what I observed. Okay, but of course the family did not actually listen. Okay, did not listen to my suggestion, and because the oncologist was their relative, and supposed to be a prostate cancer expert. Okay, so my purpose of there was really to reduce the side effects. Okay, the patient's trembling get worse. Okay, in other words, the body was shaking as one of the side effects of the hormonal treatment drugs. And they went to see the neurologist, and he was diagnosed with Parkinson's disease. And of course, given the Parkinson medication. And these two medications, the hormone suppression medication and the Parkinson, is actually doing a lot of harm to the patients. Okay, he cannot talk. Okay, his brain become very, very slow. He can understand what you are talking, but he cannot reply you. His legs are weak. He cannot walk. And sometimes you can see he is trying to express himself, but just cannot find the correct word to explain to you. And his voice very, very soft. So my therapy session is actually focusing on his digestive and immunity functions. Give him some yang qi to keep his life going. Okay. He continued to take supplements. I recommended, but the combined effect of the medication are too strong to overcome. The point I want to make here is yang qi make man masculine. Without yang qi, man cannot function and live normally. Of course, women too. Okay, and of course, in this case here, the point I want to make to share with all of you is really, if the patient continue to do this type of treatment and they want to continue to using Onetsu, the positive effect on the cancer's condition, the cancer patient's condition cannot be over expected. In other words, the chances of healing is limited. Okay, so this is a very quick case. This patient is my present patient. Last case I want to share is throat cancer. Throat cancer here, many years back also. Okay, patient was a 60-year-old man in Hong Kong. I live in Singapore. He was in Hong Kong. He was upon a friend's recommendation. I met him in 2012 when I went to Hong Kong. I went to visit him, and before that, he had already got radiation, okay, done to his throat via his mouth as part of his protocol to treat his cancer. I wasn't sure whether he did chemotherapy or not. But his cancer was in remission. Okay, but he lost his taste bud altogether after his radiotherapy session. In other words, he could not taste any food anymore since 2010 after his radiation therapy. Although I met him 2 years later, he still cannot. In other words, food to him is tasteless. I brought a device, my Onetsu device, and I showed him how to use it for healing. Again, that was 10 years ago. I showed him to work on his back, on his neck area. And I left. 1.5 years later, he called me to thank me. Why? Because he had gained 70% of his taste bud back. In other words, 70% of the food he eat now got taste. He was extremely happy after 1.5 years of cell therapy with the device. I visited him again in 2016 when I went to Hong Kong for the second time. He looked good, although he was very busy with his business. I reminded him to stay stress-free and use the Ontessu device regularly, because he told me that he had stopped using it about a year after he regained his taste bud. We still maintain contact with one another after that. So in other words, it was actually, after his throat cancer in 2010, 2012, I met him. And then after that, he remained cancer-free 2016. Okay, but stopped using it. So 4 years later. But in 2018, I received an obituary email sent by his wife from his email account saying that John had passed on. That was 6 years after I met him in 2012. My subsequent conversation with his wife revealed that John went for chemotherapy when cancer relapsed and spread. But he told me that in the final days, the Ontessu device was very useful to him as it helped him to reduce his pain. Yeah, that is the last case I want to share with you in today's presentation. Thank you very much. Any feedback, any questions from the participants?
Yes, one question.
טיפולים בראש, בגלל שזה שפיר, אז זה מגיעים אחרת, וזה לא מתפרץ לסרטנים.
Do you think that the malignant, like tumor, that there are cancer or other malignant, do you think that they react different to the hyperthermia?
You mean which particular patient or general?
Like, do you think that the brain tumor, if it's cancer or if it's just not cancer, do you think they react different to the heat, to the hyperthermia?
I mean, based on the clinical study, I think the local hyperthermia does have an effect on the brain tumor itself. That's why for the 2 cases of my brain tumor, although they are benign, I asked them to apply the heat on the tumor site directly. I believe so. But so far, the treatment has not actually produced any shrinkage in the brain tumor, but it has stopped it from growing larger.
Yes. But if this tumor is not cancer tumor.
Yeah, I think it is again, you see, all these kind of therapies depends on how well the person actually applying the device to the area. So I believe that if the intense heat actually sufficiently go into the area, of course, for me, I have a person with brain tumor, I think, coming to me. In fact, for the girl with the brain tumor who actually suffer from the loss of the eyesight, I also recommended her to use hydrogen. Okay, because hydrogen is also very good for the brain. I have read studies done in Japan using hyperthermia and hydrogen inhalation to stop cancer. I recommended hydrogen to the mother, but at this juncture, they could not purchase it. Yeah. So if there is a cancer patient who want to try hydrogen therapy, it will be very good because hydrogen is the smallest molecule, and for the brain, okay, the cells, the capillaries are too fine, especially in the brain, and a lot of the antioxidant agents, they cannot go through the blood brain barrier. Okay, they could not pass through because the gap, I mean the opening is too small. However, hydrogen is actually very, very minute. It is the smallest molecule in this universe. It can go through any part of the body. And the powerful thing is it is anti-inflammation. You want to remove inflammation, it will be very powerful. And brain tumor, brain cancer especially, is actually inflammation in the brain. I strongly believe that it will help. Although I don't have any case for me, for myself at this moment.
Okay.
Yes.
Thank you very much, man. It was fascinating. I think all of us learned a lot and have a lot to think about it, to digest, and then to start to work with. And
Yes.
we'll meet you in 2 weeks.
Yes, so I think for all of you, I hope my sessions bring you some usefulness. And in case you have any questions, just pass it to Zoha, and she can actually pass it to me. But I may not have the time to answer them because I will be going on holiday tomorrow morning.
Enjoy, Ming, and see
Yes.
you in 2 weeks. And the question we will ask maybe at the beginning of the next session.
Yes. Okay, I think it has been a long day for you and for me as well. And with that, I stop the session, and I hope to see all of you again on the 22nd of June.
Good night. Thank you.
Yeah, okay. Yes. Bye-bye. Bye-bye.
גם לא מזמן. לא, זה לא הקורס שלי.